Do you constantly feel like you have neck tension? You wake up in the morning and your neck is so tight and you're always stretching it. Well, today we're going to talk about what you can do instead to shift that pain and discomfort into something that's way more productive and also train to understand the root causes. Hi, my name is Dr. Ariane Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and owner of the Movement Paradigm. And the reason I love talking about this is because we see so many people with chronic neck pain and all different forms, whether it's I turn to the right and I feel pain on my right, or I wake up in the morning and my neck feels tight. By the end of the day, there's so much tension here. And there are so many reasons, all of which we can't dive into today, but just to give you some ideas of why you want to begin to ask the question, why? Where is this coming from? Why is this happening? Number one is going to be poor breathing patterns. When we are breathing from our accessory muscles, so using our neck and our shoulders to lift the rib cage, unfortunately, that's going to create ongoing and increased tone in the neck musculature, specifically the trapezius, the sternocleidomastoid. So oftentimes you're going to feel this constant tension. So the number one thing we want to look at is breathing first. With breathing comes airway. So if you find yourself waking up in the middle of the night and you feel tight or painful, or you wake up in the morning and you have a headache, this is definitely indicative that you want to look more into your airway health. And this can be done by getting a proper screen and evaluation, even potentially getting a sleep study so that you can really understand why you might be having pain first thing in the morning. This could be related to a nasal obstruction. This could be related to jaw position and so on. Next up, of course, is chronic stress and or ongoing trauma. So when we have any type of chronic pain, we want to be thinking about mitochondrial dysfunction. So this ultimately means think of our cellular health. If we are having this ongoing signaling of pain and we're unable to dampen it, then we have to really consider what's happening at a cellular level. And this could be related to a multitude of things, but stress and chronic nervous system dysregulation can be a big one. Systemic inflammation. So if you are perhaps eating foods that you might be allergic to or sensitive to or intolerant to, and you are potentially exposed to a lot of stress or even toxins in the environment, all of these things could be contributing, and many more, to ongoing or persistent inflammation in your body. If we have leaky gut, for example, leaky gut produces an endotoxin called lipopolysaccharide. This can create an ongoing immune response and can look like, for one person, shoulder pain, and for another person, it could look like they have an autoimmune disease, and for someone else, they might have pain all over their body. So it can vary with how it presents, but when we think of this ongoing presentation or chronicity of pain, we want to be considering this ongoing inflammation as well. And let's not forget the mechanical compensations that are contributing to any type of pain in the body. So this could be far reaching. So oftentimes wherever your pain is not the source of the problem, and it could be associated with fascial restrictions, movement compensation. So when I think of neck pain, I'm often immediately thinking of the diaphragm and how is the shoulder and the shoulder girdle stabilizing? Is there an appropriate amount of mobility in the thoracic spine? What is the foundation of the feet? So are we in a neutral foot type? Are we more inverted? So think a higher arched foot type or a flatter foot, an everted foot type. All of this is based on our foundation of our body. And so if this is altered in any way, and that could be for, again, various reasons, then that is going to influence how we're able to transmit force through our spine. So oftentimes we can have a weak link, and sometimes it can be the neck. So we do want to consider all of the mechanical components in addition to all of the things that I mentioned. So what can you do about it? Let's start with diaphragmatic breathing, which is the first and foremost. We breathe 25,000 times a day. So we want to be able to, regardless of airway dysfunction, optimize our breathing to the best of our ability. So tongue at the roof of the mouth touching the top teeth. We want to think about breathing up, not back. As you breathe in, we want to think of the teeth just a little bit apart and the lips are sealed. As you breathe in, you're expanding the abdomen 360 degrees. But what I want you to really think of is not allowing the chest to rise and to fall this way. Okay, so it can go this way, but we don't want it to go up and down. So, meaning we don't want to create this tension in the neck musculature like this. We want to try to keep all of this relaxed, really emphasize this good rib cage expansion. So as often as you can practice this before bed, when you wake up, when you're in the car, there's so many opportunities to practice this conscious breath so that it ultimately can translate into more of your normal breathing patterns. A tried and true favorite is the salamander. So this is a version of Stanley Rosenberg's exercise. So we're going to interlace the fingers and bring them behind the back of the head. So we want it to be at the occipital area. From here, you're side bending your upper body. So think of the upper back. You're going to look with your eyes the opposite direction. So I'm looking up towards my right elbow, keeping my face forward. I'm already going to go in. So you're going to hold that for about 30 seconds. Come back to center and then bring it to the other side. So face is forward, looking up to the left. And when you're finished, you should ideally test this before and after. Test your neck range of motion. It should feel an immediate improvement. We're basically putting an input via the hands to the occipital area and the neurological input from the eyes. So all of this is going to influence the brainstem and blood flow to the brainstem, which is going to help with the spinal accessory nerve. So it's going to relax the SCM, sternocleidomastoid, and the upper trap via the spinal accessory nerve. So this is a great one to relax and calm the nervous system right away.